Hey, it's Anika.
And Ashley.
And we're the Real Nurses of Miami. And we're here with the lovely, lovely, lovely Triggs coordinators. Could you please tell us who you are?
My name is Amber. I'm one of Dr. Triggs coordinators.
And my name is Gabby. I'm also one of Triggs coordinators.
So now you can see the beautiful faces behind the voices that you guys hear.
So just so you girls know, Dripped Embodied is 100% Dr. Triggs coordination certified. Yeah, seriously. I remember a personal friend of mine got surgery with Dr. Triggs and she needed an iron IV because she wasn't feeling too well after surgery, which is normal. And I had texted Dr. Triggs and he said, I think you should write these nurses, they're really good. And he always used to recommend you guys. So now I tell our patients about you always.
And our patients always have great
things to say.
Because I feel like that's what pushes us word of mouth.
Yes.
And we really appreciate it. Thank
And if
you.
you do have surgery at Vixen, you guys can use the discount code VixenBabe10 to get 10% off any service.
Thank you for having us.
Thank you for tripping with us and chatting. Okay, so we have a few questions from like a coordinator's perspective. First question is, what is something you guys find really important that patients need for their post-op?
Well, a post-op drip, of course, to help boost your energy. And then
I definitely feel like a nurse is super important, at least for the first 24 hours, just so that way you have somebody to check like the important vitals and signs of if anything were to go wrong, they would be like first person to make sure it's okay.
From a coordinator's perspective, what do you think clients should consider before considering surgery?
well, I definitely do think that budgeting is very important. I don't think patients realize how much money goes in to aftercare in your surgery. So they just think that they're gonna pay for the surgery and that's it.
Seriously.
Yeah, and the post-op care is, I think, even more expensive than the actual surgery. Like it's very important.
You guys ever seen the TikTok where she's like, okay, I booked my BBL, and then like there's like a cha-ching sign, she's like, damn.
No, literally. I feel like,
you know, it's like your surgery, your massages, your recovery nurse,
transportation,
your lodging, your flight,
extra
food,
the amount of massages that you don't even think that you're gonna need. You have to factor in like for like maybe extra IV drips just in case you're not feeling well. So there's so many things that add up that you have to think about and pre-budget for before having surgery. You don't just wake up on the off the table and look sexy. I mean, you do, but
and even
it's a process.
And I think for patients that come from out of town, it's even worse because I live here and I did it, and my aftercare, my transportation, everything, I couldn't drive, so it's a lot of budgeting that you need to.
Yeah, I'm happy that you touched on that too, because I always like ask clients, okay, so like how much time are you taking off from work? And sometimes I get answers like, 2 weeks, and I'm like, do you work from home?
Yeah, exactly.
What is your commute gonna look like if you're having a BBL? So it's just like, you know, the logistics of like, okay, when I go back home, what is my new reality gonna be for the next 6 weeks or so as you continue the recovery process? Because it's not like, okay, I'm in Miami for 5 days and I go back to my regular life. No, it's gonna take some time before you actually really 100% feel like yourself. For you, like how long do you think it took for you to feel like I feel normal? Like I feel
normal. I think I could go back to work, but feeling actually normal at work and everything, it took me like a good month and a half to finally feel like, I'm good at work. I don't get that tired. My legs aren't getting swollen because you're standing all day, especially with the BBL. You get swollen. You have your back hurts, like your feet hurt, everything like that. It's very difficult.
Yeah, something I do want to mention on the side as well. We do not fill out FMLA paperwork for an elective procedure. Yeah. The only one that may qualify is a tummy tuck. But aside from that, we cannot fill out anything for FMLA just because there is no real diagnosis for somebody that's just getting surgery. So
looking sexy.
Yeah, exactly. So that's another thing that patients constantly ask us when it's coming back to like taking off just 2 weeks from work and maybe having to take off more. Now you have to consider that you need to be able to take that time off and not fill out any FMLA paperwork. The other thing I was gonna say was maybe some preliminary labs, just because we accept the labs within 40 days of surgery, but you get your lab paperwork from the moment that you get your welcome call from us. Right. So maybe you just wanna check in with your doctor's office, see where you are health-wise, and that way you know what to work on. So by the time you submit your labs to us, you're already good and you don't have anything to work on.
I'm happy that you highlighted that because I tell clients, because if you go with LabCorp, you can just book like, you know, a CBC. And the biggest thing that gets people canceled is their hemoglobin. They're anemic and they don't know. So I tell my clients like, hey, go ahead and get some lab work done so that you can see what your hemoglobin is, so that if in the event it is low, you have time to work on it. Because some people don't have access to IV iron. Like, you know, Miami, we have everything. Right. But we have people that come from Kentucky and like all these different places that they're not like in with the IV therapy stuff. So I'm really happy that you brought that up, but now I can tell them, I know they sent you your welcome.
Oh yeah, we do.
Go get your labs done.
Yeah.
Like every patient is different with their hemoglobin. If your hemoglobin is low, not everybody's levels go up in the same amount of time. Everybody needs a certain amount of time for it to go up, and it's not the same for everyone.
Yeah. Okay. One last thing now that we said that. And if you're not going to do your preliminary labs just to see where you are as far as blood work, I would say get everything that you book with insurance. So your hotel with insurance, your flights with insurance, because you just don't know where your health is going to be. And if you need to reschedule and you don't want to feel bombarded with, oh my God, I just spent this money and I can't rebook my things.
Yeah. And also, I don't think people realize you need to stay at least minimum 5 days after surgery.
And that's for a BBL.
If you're flying in or flying out, minimum 5 days.
That's if you have no drains.
Yes, exactly.
Our last question is, what is like a pet peeve of you guys' that you'll get presented to you as a coordinator?
I think ours is the same one.
Lying about medical history or medical conditions. Like the reason that we ask that question is so we can send you the right lab order or know if you're in fact a candidate. And so once we find out later down the line, and then we throw more clearances at you or more lab work that you have to get done, and people kind of get upset or annoyed, but we just try to prepare for that, and that's why we ask. So just being honest.
Yeah, we also try to avoid you flying out here. For example, most of our patients are flying in, and then you getting canceled the day of your pre-op because you lied to us the entire time.
We hate doing that. It's such a bad feeling to have to cancel anybody. We know that you guys take time off work. Yeah. You come out, fly
you guys
here.
Are excited.
Yeah, and then for you to end up disclosing something and us have to cancel your reschedule, it feels horrible on our end as well.
And it's so funny because like on our end, they were like, oh, they're sending me to get cardiac clearance. They didn't tell me that, And it's just like, oh, why would they do that?
Right,
but now, like hearing it
Knowing.
from your side, it's like, I understand now. It's like, okay, you weren't being fully truthful.
Right.
Or for example, they're not, I guess, fully aware. They'll go and get their physical done really close to their surgery, and then their doctor will say, oh, this person has a heart murmur, or this person has something in their EKG that came up, and they didn't do it until like 3 weeks before surgery, and now we have to ask you for this.
Right.
Yeah.
Oh, that's very... It makes sense to just put
everything full circle.
Because, like I said, from our end, it's like, oh, they didn't tell me. And I'm like, oh, that sucks. Why didn't they tell you that? I mean, you know what I mean? But now I get it, because it's very true that, like, even when we do our pre-op calls with our clients and we say, like, do you have any medical history? Do you have any medications that are prescribed to you by your doctor? I have to word it that way, because then they're like, oh, I don't take any medications. I don't care if it's as needed. I want to know what it is, because there's been times where we go to the client's hotel room and their medications are lined up, and you see like Xanax, losartan, amlodipine, whatever, and it's just like, I didn't know you had high blood pressure. I didn't know you had anxiety. Even if it's something as little as anxiety, I need to know that, because that is going to change our treatment for you.
Tailored care.
You know, it's going to tailor their care, because I find that people that do have anxiety, like, you know, they need a lot more like reassurance, and you know, even if they're not in pain, sometimes it's not pain, it's just the anxiety, and they just get super worked up. So it's very important to know that.
Right.
You get super overwhelmed, and it makes your recovery a little harder.
Thank you so much, ladies. We appreciate it.
Of course. Thank you for having us.
Right.
I see the energy coming through.
You're going to be excited for Monday.
Yeah.
Wow. Bright and early tomorrow.
All right. Thank you, guys.
Thank you.
Bye.